Waist level is best, so you're not leaning over. That's it. Yeah, see, a lot of you are tall, so this is not even waist level.
Yeah.
It's not, even for me, it's not waist level. So you want to put clean gloves, right? And of course, don't break the gloves like I just did. These are horrible gloves. They broke so easily.
Like sandwich gloves.
Yeah. Okay. So you put your gloves on, and you're gonna now. If you're gonna assess here, then you're gonna just pull down and pull up. So you want to keep the patient as covered as possible, right? Now this patient has a dressing on, but pretend there's no dressing, okay? So you keep them as covered as possible, and you want to go above the suprapubic area, right? And you're going to palpate to see if the bladder is distended, okay? Bladder is not distended, but the doctor ordered it. Could be pre-surgical. There could be any number of reasons, right, why they ordered it. If the patient is distended, then that's probably the reason, okay? And then you're going to cover the patient up, okay? Now the next thing you're going to do is, if you're planning on doing this, you might have wanted to do this before you put the gloves on. You could have gotten a basin of water and had it set up already, or you can just get everything and put another pair of gloves on. So I'm just gonna inspect to see what's down here, and I'm gonna say, let's say she said, oh, I just took a bath. So she's clean. There's nothing you need to do, all right? But if she wasn't, then you would do pericare, because you want the area to be as clean as possible, okay? And just regular routine pericure with soap and water, that's all. Nothing special, okay? All right, so now you're gonna do the procedure. You wanna, go get your stuff. So you're gonna take off your gloves. Make sure, remember, you take these off the right way, because I freak
Pinch, yeah.
when you don't take them off the right way. Center, then under, right? So
Yeah.
glove to glove, hand to hand. And then what happens is one glove is encased in the other, so you're not gonna touch anything. And you should have a garbage.
Over there.
Yeah. Should have a garbage pail nearby. Okay, now, I'm going to show you actually what we do if you don't have a garbage pail nearby. I'm going to wash my hands, right? I already identified the patient. I'm going to bring my supplies. This tells you what's in here. Obviously, every package you take tells you what's in there. And you know, most of the time you have everything you really need in this package. You usually don't have to get anything in addition. However, if you either have separate catheters that are in packages in your hospital, or if you don't, you always want to bring another catheter, and sometimes I'll bring extra sterile gloves and maybe even some 4x4s if you think you might need them, okay? But if you don't have all the things separate, just bring another package with you. Because you don't want to be at the bedside, have a patient all ready to go, and then something happens and you contaminate, and now what do? You're going to have to close her up, go outside, go get another package. You know, it's better to just bring an extra package. You could always bring it back, okay? It's contained in a sterile package, all right? The other thing you want to bring, which is not in a package, is the attachment for the tubing to the leg. Now, can you do it with tape? Yes, and I'll show you how to do it that way. But it's better if you do it with this, because it stays on, it's more secure. The tape oftentimes comes off, okay? If you're gonna put this or the tape, when's the best time to put it on?
After?
Before.
Oh.
Why?
Gloves.
No, not because no gloves, although that certainly does help. Because if the skin is intact, you don't really need gloves, but why else?
You're saying before, what's the
Before.
difference? Before,
Or
after?
yeah.
So you don't, isn't one of them like don't use one of them as a port and stuff? We don't want to.
No, not really.
Oh, yeah.
The skin is dry. What happens when you're anxious?
Oh, you sweat.
So you're gonna have a patient that's gonna sweat through most of the procedure and probably be sweaty afterwards. It's gonna be hard for this to stay. Before the procedure starts, you just cleaned her, right? Or she cleaned herself. You make sure where you're gonna put this is clean and dry, okay? So you're gonna put it on her thigh, right here, all right? Or there, either one. If you're right-handed, I suggest you're on her right side. If you're left-handed, I suggest you're on her left side. So left, left, right, right, okay? This you can just open, because it's not sterile, with your clean gloves. And again, if she's intact, her skin's intact, it's a heck of a lot easier to put this on with your bare hands, because nothing sticks. But there is a way to do it so you don't come in contact with the sticky stuff, okay? You only take one side off. You put the one side on, flatten it. Then you take the other side off, and you bring it down and flatten it, okay? And even I screwed it up, see, because it's not completely on. You want to try not to have it fold over if you can help it, okay? And then the tubing goes in here. And I'll show you how to do it. Now, what if you don't have that? You can use tape. Again, you're going to cut the tape. You're going to make yourself a couple of pieces on here, okay? Usually I do one long, thick one. Also, you want to clean your table off before you start because you don't know what was on the table. Usually food, which is not so bad, but still. The other one I'm going to make long, but I'm going to slit it in the middle to make two skinny ones. Okay, like this. And then, before I start, I'm going to put a piece on her leg because now she's clean and dry and not sweaty. So I'm going to take a piece and I'm going to put it like this. I'm going to press it down really well on her nice dry skin. And I'm going to take a piece and put it like this, crisscross, on her nice dry skin. Okay? Got that? Okay. By the way, I'm telling you this is on video already, but if you want to take video, I don't really care. Okay, so now we have the pieces on her that are going to hold the tubing from pulling. Okay, so now I make sure I have my sterile gloves. Now there's sterile gloves in here, but you may want separate sterile gloves and have an extra pair anyway. Because the gloves in here are a little on the small side. I'm going to try to use them, but if they rip, I'll always have the extra gloves, okay? So, you don't have a garbage bag, let's say. We used to use this, and it's actually, I find, sometimes more convenient than, you know, because you can always accidentally contaminate when you go to a big garbage like this. Okay, so you pull this open like this. The inside is your sterile package, right? You put your sterile, oops, that's okay. Put your sterile package on the table. Take this. You fold it over like this. And the cuff is really important if you're going to use the packaging as your garbage because it keeps it stiff so that it stays open. If you don't, it keeps closing on itself and you're going to end up either contaminating or having trouble getting all of your equipment in there. And then you just take tape again, and don't be afraid to put tape. I don't know why students insist on putting one little tiny piece of tape and it ends up falling on the floor once it gets heavy. I usually put 3 on to keep it from falling. You see, and now you pretty much have a nice stiff little garbage bag, okay? All right. You're gonna see people put this over the patient, you're gonna see people keep it out. It's actually safer to keep it out because if something happens and the person kicks, everything goes all over the place. So you're actually safer to keep it on the outside. Some people put the bag over here, some people put the bag over here. I don't care where you put the bag, as long as you don't contaminate, it doesn't matter, okay? So let me see, this is a label, there's 2 labels. Again, don't ask me why there's 2, I have no idea. You only need 1. It goes on the bag to say the date that you initiated the procedure and put the bag in. The bag and the tubing are attached, okay? The only reason you might need another label is for some reason the doctor comes in and decides he wants to just change the bag and not the tubing, which very seldom ever happens. If they're going to change it, they usually change the whole thing, okay? I don't even know if you can get a bag without the tubing anymore, you know, but who knows. They probably should have one because I know they still have individual catheters, but those are oftentimes used just to catheterize like right then and there. But then they shouldn't be a Foley, they should be a straight catheter, and she showed you the difference, right? The red rubber ones, the harder ones, are the ones where you do intermittent catheterization. So you just insert it, the urine goes into the bedpan, or in the toilet sometimes if they're doing it on their own, independently. They just hang it like in the toilet and it just pours in the toilet. And those can be used over and over again. They can boil those. Or they can be put in antiseptics also. Because sometimes they bring them to work with them. They put them in a little antiseptic, then they just, you know, clean it and put it back in the antiseptic again. But anyway, these are rubber or latex, whatever. You know, they could be also made out of other materials if they're allergic, because that's a very common thing It's a latex allergy, okay? This would just need to go on the bag, but there's another one in here. I don't know why they have two. Okay, so when you open your bag, how do you open? First towards you, okay? Then side to side, right? And then finally, okay, and the most important thing is that you don't reach over, okay? So you could also do this way. But if, let's say you open it the wrong way, and don't reach over. Always reach around, okay? You don't want to ever reach over your sterile field. Now, once I have it open, the gloves are inside. Take the gloves, go away from the sterile field. But don't go like this. Why?
Because you don't turn your back.
Never turn your back. So just move back further and come over to whatever surface that you have. Open up your gloves. Remember, you have how much around the side of a sterile field? Yeah, about an inch. Okay? And then pick up your glove now from the inside, right? Because the inside is against your hand. So again, this is the part you're going to put your hand in. These are small. I don't know if this is even going to work for me. These are really small, and they're also not very well powdered, so they don't. Okay, but if you can't get it all the way around, don't touch the outside of the glove, okay? Now I can touch any part of the glove, right? However, as soon as I put my hand in contact with the inside, I have to take my thumb off. You can't hold the inside of the glove and stick your hand in, because now your hand is coming in contact with your other hand. Okay, so that would contaminate it. So once my hand comes in contact with the glove, I can only stay under the glove, right? Any part of the sterile part I can touch. Oh my God, this is a horrible glove. It's really, really bad. Okay. So now I can fix the other glove, right? Mm-hmm. Okay. Still very stiff, very stiff. Okay. All right, so now there's two things here. One of them you really don't need, and one of them you do need. This one you need, okay? Now, what mistake did I make? Because I did make a mistake.
You opened
not
it up?
with this.
Oh.
What didn't I do?
The patient.
Pick the thing up for me. I didn't close the curtains, and I didn't pick up the thing. And you need to position her legs. So can you bend her legs up for me? Yeah, that's what you have to do first.
Before the glove?
Put up the
Oh, with
put
the
up the
glove.
sheet.
Oh.
Put up her legs. Yeah, position the patient. That was what I failed to do. Now, because I have sterile gloves on, I would have to put the other sterile gloves on. That's what I would have to do if I made that mistake, right? Okay, this goes under the patient.
There we go.
Now, you want the shiny side down, because that's the part that, keeps the bed from getting wet. And what you do is you grab each side, you turn it like this, in. So you're protecting the sterile part, okay? Now, obviously, you got to protect your hands as well. So you're going to just let it go down, and you ask the patient to lift if they can. If not, just leave it down there so it's right at the edge. What you're trying to prevent is the bed from getting wet from the urine, that's all. Now, also, you should have chucks under her as well. So you make sure there's some kind of protection under her, and then you're going to put this on top as well. This one, which a lot of people think is just made for the penis, it is not, okay? I'll show you how it's used, but you don't have to use it for the test, because students freak out for this reason, I don't know why. Okay, you put this over like this, and why do you think I want to do that?
You just want to expose the area you're going to go
Yes,
in.
but why?
Privacy.
Oh, yeah. And the
Oops.
patient gets cold. Oh.
Prevents me from contaminating myself against her leg, okay? So it's not the worst thing in the world, because again, when I come down here, it prevents me from touching her body, okay? I'm not going to use it right now because, well, I could use it. What the heck? You can see, right? Everybody can see, or should I take it off because you can't see? You want me to take it off?
Yes.
Okay.
Take it off.
Doesn't matter. I don't care. I'm just saying because I want you to be able to see. Okay, so here's your package. You can turn it around. Remember, you have an inch around. So be careful that you're not going beyond an inch. And you can take both of these out like this. You have more than enough space around the outside, okay? This you're not going to do anything with. This is for cleaning. when I'm ready to go down, I'll open it up. But this has the lubrication, okay? So I'm gonna need that. And then again, there's a label. Don't ask me why, like I said, I have no idea. And then this is the liquid that we're going to push into the balloon to inflate the balloon, okay? So what I need you to do first is to check to make sure, and this we don't really use, this is for culture, and it's only if it's ordered, but if it's not ordered, then we can get rid of it, okay? You want to make sure that your tubing isn't curled up, and you also want to check to make sure that your bag, which is sterile, is locked, okay? Because you don't want urine getting in the bag and then dripping out. So the way this locks, if you look at this, that's open. Can you see how it's open? And then when you push it the other way, it just goes across and locks the top. Okay? So once it's locked, you know for sure it's locked, then put it back. Okay? And then you're all clear with this, but we have to check the catheter. So be careful, because this is where students contaminate. Keep it somewhat, you know, so that you have control over the catheter. Don't just fling the catheter out. Pull it out gently and keep the catheter like curled in your hand. Otherwise it can hit something, okay? And again, I'm gonna move this over because I don't have that access, okay? All right, so now I'm gonna hold the catheter in my hand and I'm gonna take this, which this connects here, that blows up the balloon. Everything on you here is sterile, so you don't have to worry. And I'm gonna connect this up here. Now, how much is in this syringe? About 10 milliliters.
10.
Okay, how much do we put in here?
5 to 10?
5. No, 5. You
5.
see what it says? If I put 10 milliliters in this balloon, there's a
pop.
chance, excuse me, there's a chance that I could blow the balloon. You know, have it. Because sometimes you accidentally squirt the fluid out, or you don't have. They want to make sure you have a sufficient amount, but some nurses don't really look and they push the whole thing in. You're putting the patient at risk that it's going to. Now, what's going to happen? Nothing. It's going to come out. You're going to lose your catheter. You're going to have to put another one in. It's not going to hurt the patient, but it's going to screw up your catheter. So why do you want to do that? Okay. So you put in 5 to see that the balloon is not, you know, that's intact. It's not leaking, right? It's fine. Now pull it back. Make sure it's completely deflated, because that's uncomfortable if you try to push that into a patient. Okay, now everything's good. Leave it on. Don't take it off. And you're going to now put jelly on. So we're going to not really do this. Pretend you open the jelly, dip it in the jelly. Some people leave it in the packet. Some people just leave it here. You know, there's actually a little edge on most of these. This one doesn't have one. But it doesn't matter, as long as it has it on there. So you can either leave it in the packet, leave it here, or some people put it in here and then dip it in right before they're going to use it. You can do any number of ways, okay? So now we're ready. Go ahead, question.
This comes with liquid inside of it?
Yes. So everything comes
pretty
already
great.
in the package, okay?
Cool.
I'm going to now open one of these, because you really only need one. They give you 2 again, because what if the patient, for some reason, has a lot of drainage coming out or something like that? You can still have more to wipe, okay? So I'm just going to open one, and I'm going to make sure that I pull these out, because it's hard to pull them out when you're in the process of doing it, okay? And I'm going to lay them here. I'm going to not use this, so right now I'm going to put it there, but you could leave it in your package, okay? This on top of this here, and then this is the easiest way to do it, is to bring this over to the bedside. Okay, don't overlap too much, because over here is essentially sterile, but once I overlap here, this is kind of a little, right here is not the most sterile place because it was laying on here. Okay, so I'm gonna take this and bring it over here so that I can do my cleaning. Now once I take this hand and touch, this sterile hand becomes dirty. So I can't move it. I can't say, oh, I got it, oh, I lost it, oh, I got it, oh, no, you can't do it. Once you put it there, that's it, okay? If the labia flap back over, she's contaminated. You gotta start all over again, okay? So you have to come down and you have to spread with your fingers. You could spread like this, you could spread like this. Usually these are your strongest fingers, okay? And then you're gonna come over here and you're gonna clean. 1 swab for you're going between the inner labia and the urethra, Not the, some people say, oh, it's between the inner labia and the outer labia, or it's not. That was cleaned when you washed her. That's her outside tissue. This is simply to clean between the inner labia and the urethra. So that's why there's only 3. So you go inner labia down, and then you throw it out. The outside on the other side, the inside on the other side, inner labia down, throw it out. And then the last one goes straight down from the urethra, not from up here, from the urethra straight down. That's it, clean to dirty. Got it? Okay. Then you're gonna get rid of this, so you can just put it on the table, it doesn't matter. You're gonna bring this over, and, or you can just bring the box over, it doesn't matter. This already has lube on it, right? You're gonna take this, and you're gonna go over here, and you can't go like this. The students go like this, I say, no, that's not gonna work. You gotta start from here. You have to have control over the tubing, right? You're gonna look at her urethra, and how far am I gonna go in? 3 inches, 3 to 4, and then if I don't see anything, I'm gonna go in another 2 to 3, right? Now, you heard what Professor said, you can actually push the whole tube in. And a lot of articles have supported the fact that you actually should. So I really don't care how far you go in, as long as you go in more than like 5 inches or so, okay? And you see urine. Now, we're not gonna see urine on her, but you say, okay, I see urine, okay? Now that you see urine, you have to push that in. So, oh, how do I do that? Well, now you can let go, because the thing is inside her. Take those 2 fingers and hold it. Otherwise, what's gonna happen?
It's gonna
It's gonna come flying out, because the pressure, she's gonna go, and it's gonna come out. You hold it, you take this, you push in 5, okay? Once you have 5 pushed in, I can let go. Why? Because the balloon is blown up. Now I'm gonna come here, and I'm gonna take this off. However, if I try to pull that off, what's gonna happen? It's gonna squirt all over the place. So what I'm gonna do is I'm gonna clamp it and then take it off. Okay? Now I don't need this anymore. Now I can let go, right? This should be okay. Now I need to connect, put it on, and now you should see urine filling the bag, right? So you're gonna keep an eye on the fact that you don't want too much urine going in the bag, right? I'm gonna take this and I'm gonna come up here. Now you do not want this to pull. So you have to take this and put it right here, and I'll show you why. Because this bifurcation is gonna prevent it from pulling. If I take it and I put it here,
It's still gonna pull.
it's gonna pull. So it has to go in between the bifurcation, just like that. Okay? Now you're good. Now, I don't wanna touch that bag with these hands because otherwise it's, it'll be contaminated and then somebody touching it, and all of that. So the best thing to do is remove this with these hands. And it doesn't really matter because this is going in the garbage anyway. Okay, and put that on the bed, right? So now that I can touch with my clean hands because it's on a clean surface, hopefully, unless you got urine all over the bed or something, then you'd have to you have to put another pair of gloves on, okay? Because I don't want to touch that with these hands because I'm going to put it down here at the bed. And somebody might come, like a nurse aide, and say, oh, I'm going to empty that and don't put gloves on. Which is not a good idea, but it could happen. So now that I did that, I'm going to take off my dirty gloves. Again, the same way. Right? And now I can take this. Now, some people are so paranoid, they don't want to touch this. It's sterile, but if you want to feel like you want to put clean gloves on, go right ahead. The hospital might kill you after a while, but that's okay. All right, where do we put this?
Not on the floor.
Not on the
bed
floor.
frame.
Where on the bed frame?
Not the side rail of the bed frame.
Someplace that's not mobile, if you can help it. Now, most of the time, I don't know if this one has, they have like a little bar that comes down. This one doesn't have it. And if you can't find a bar, usually there's a hole or something you could stick it into. Is there a bar over there?
There's like a hook at the Elmhurst.
Yeah, there's a hook that comes down. That's what I mean. There's a bar or a hook.
Yeah.
Okay. But you want it to be lower for gravity. I just stuck it in a hole.
Yeah, it's cool.
You want it to be lower for gravity, right? And you want to make sure, and you're going to put her in a more comfortable position, right? Going to put her back. Okay. Okay. And then this, which is a laugh, I think, but it's good for, I'll show you the purpose I use it for and what most of us use it for, you're supposed to really clip this onto the bed just for extra protection. So again, if somebody goes like this, you have this and you have this, okay? But what it is good for is, let's say the doctor comes by and says, I need a urine specimen. They don't want you to use this stuff in here because it's sitting there.
Right.
Sometimes you have the kind that did Professor show you the one that has the graduated part? Okay, sometimes they'll allow you to use that for UA because it doesn't have to be like sterile. However, if it has to be culture for sterile, or some hospitals have the full piece like this, they don't want what's sitting in there because it gets stagnant. So what you need is something in here. So if you go like this, the urine in about 15 minutes or so will fill the tube. Then you come back, and I'm going to use this syringe because I don't have another one.
Where'd you get that rubber band?
It was there.
Oh, it's
It's
in
part of the thing. Yeah, they use it to clamp onto the bed. I don't, like I said, maybe they put it there for that reason. I don't know, but that's what we use it for. Okay, this would be empty. You would bring with you to get the specimen. You would bring with you clean gloves. I would bring. I wouldn't touch everything with my hands at that point. Clean gloves, chucks to put on so it doesn't, when you're pulling out the urine, it doesn't spill, and whatever container you need. So in this case, the container that came in the package, again, chances are you wouldn't be taking it from this anyway. But you would have something like this, or it would be, the ones we showed you in fundamentals, looks like a big round for urinalysis and also sometimes culture. Like it looks like a little cup, yeah, exactly. But this would have nothing in it, right? I don't want to. Can somebody squirt that in the sink? Oh, never mind. I'll squirt it. Just a little. So you bring a sterile syringe in a package, and you bring this, which is sterile inside, and you bring your gloves. You don't have to wear sterile gloves though, because you're going to be touching this and touching her skin and everything else. Okay? You put the chucks under her. You have your clean gloves on, which they didn't give me another pair of clean gloves. No, it doesn't matter. Pretend I have gloves. Put your clean gloves on.